And again, to those out there, again, ask everybody who's not in church this weekend, prayers still matter. And as the chaplain said, let's be praying for all those medical personnel and first responders and law enforcement that are out there on the front lines as we work through this emergency. Let's move on to case updates. But before we do that in North Dakota, let's take a look nationally and internationally, because that gives us a window into this global pandemic and how it is now reaching North Dakota. One of the things that we can look to, I think, when we look at Western democracies, in particular, because the form of political government that you have affects how quickly and how tightly you might be able to, lock down and stop the spread through government mandates. China had a bit of an advantage in that because of their form of government. But Italy becomes instructive then, and Italy now, which has less than 5% of the population. There's about 60 million people that live in Italy. There's 1.4 billion that live in China. Italy has now passed China in terms of number of deaths, and in the last 24 hours, they leapt up with another 793 people who've passed from the COVID-19 crisis. So this again, for folks that are thinking that that the U.S. or portions of the U.S. are acting too quickly, this is a reminder because people say you can't predict the future, but we can look and observe how the pandemic is spreading in other locations around the world. And as I said yesterday, one of the reasons why we may be benefiting here in North Dakota is because of all the travel requirements first put on federally, restricting travel from China to the United States. And now with the lockdowns in the hotbed areas on the two coasts and conventions being canceled and less vacations, less travel, less contact between people, that is certainly going to have an effect on slowing things down. And for geographies like ours that we're fortunate enough not to have one of the early cases, we're benefiting from the actions that are being taken by our neighbors and by the country. And so with the U.S., however, we still have a lot of cases happening in the U.S., 15,219 confirmed cases of COVID-19. There have been 201 deaths in the United States. All 50 states, District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands have now all reported cases of COVID-19. So it has spread across the entire country, including remote island geographies. Today, the North Dakota Department of Health confirmed 2 additional cases of the coronavirus disease, COVID-19, both in Burleigh County. One was a woman in her 20s from Burleigh County, and that has been identified related to travel. A male in his 30s from Burleigh County is attributed to community spread, meaning that there was through the contact tracing, not able to identify specific contact with someone who had traveled. What brings us to the totals, again, kudos to the great work being done by the private sector and by our state lab, but we're now up to 1,169 total tested. That's plus 231 up from the report that we gave yesterday. 1,141 of those happily are negative, which means we've got another 229 negatives from yesterday, 28 total positives plus 2 from yesterday, and we have 1 more hospitalization. So we now have 3 people that are hospitalized in the state related to COVID-19. So the good news is that unlike many other states, we're able to report that for 2 days in a row, we've got fewer positive cases than we did before. I would like to say that's be positive for a day, but as I've cautioned at every one of these meetings, testing is a lagging indicator, and the fact that we've got very few positives is not an indicator that the spread is not more widely than we might think. We now have received tests from 48 of 53 counties, and so again, at least from a testing standpoint, we've nearly reached the whole state. Again, hopefully this means that the steps that we've done to encourage social distancing has helped slow the spread of COVID-19. But again, we want to make sure that everyone understands, regardless of your age, no one is immune. Of the 28 positive cases that we have, yes, 9 of those cases are people that are 60 and older, but 7 of those are under age 30, the remainder are under 60. So what that means is 2/3 of the cases in North Dakota are people under the age of 60. And if you are under the age of 60 or under the age of 30 and you have this may not be life-threatening to you unless you have an underlying chronic disease, but you do have the ability to infect lots of other folks, which again, we want to remind people again, the basics here: stay home if you're sick, even if it's minor. And a reminder that, again, if you're well, but you've been in contact with someone who is been tested or who has been sick, even if you don't have symptoms, you still could be carrying the virus and you still could be infecting other people. So when we talk about stay home if you're sick, let's combine that with social distancing. Even if you don't have any symptoms, you should be practicing social distancing, because the actions you take could save the lives of others. And again, if you're even if you're just out shopping or for a walk, again, the recommendation is more than 6 feet away is what we're trying to get to help reduce the transmission that may be happening. And of course, regular washing your hands is also important. One of the studies that came out of Italy, when they quarantined an entire town of just over 3,000 people near Venice, they tested everybody in the town, and half of the people they tested had no symptoms but tested positive. And so again, in North Dakota, where we've been prioritizing testing, it's highly likely that we have people who have not been tested, who don't have symptoms but are carriers, which is, no matter how well you're feeling, we want to again reinforce that social distancing is for everybody, not just for people that are coughing and sneezing and aren't feeling well. Social distancing matters for everyone. And again, if you've got a family member who's being tested right now, then stay home until your tests arrive. And again, if that family member does test positive, we're asking the entire family, if you've been in close contact, that you would also go into the isolation for the next 14 days. Here at Team North Dakota, we're trying to practice what we preach on social distancing, and we respect the incredible effort that the private sector businesses have been doing across the state to allow workers to work from home. But now through the end of day yesterday, we're now set up roughly 7,100. Over 7,000 North Dakota team members are going to be working from home this weekend or on Monday. On testing, we continue to ramp up our testing, and there's been a lot of talk about testing, but I think it's important to think about testing in terms of per capita or tests per number of people. There's a lot of talk about New York doing more tests than anyone else. That's absolutely accurate. New York has tested 17 out of every 10,000 people. They've got a lot of people living in New York. North Dakota is right behind them. We've tested 15 out of every 10,000 people. So on a per capita basis, based on the information we had today, North Dakota is at the front of the pack in terms of the amount of testing per capita, and we're well ahead of our neighboring states to the west, south, and east in terms of testing. And again, thanks to South Dakota for helping us out with some swabs, as you heard yesterday. Again, we want to make sure that the whole country continues to move that up, the testing up. There's, as you've heard nationally and from press conference earlier today, testing capacity is ramping up and gaining, and there's more testing coming. But for right now, it's still important that we're prioritizing and testing those people that have prioritization. And if we need to cover that again, Mylyn Tufte can walk through that prioritization later today. On other news, I also talked to Senator John Hoeven this afternoon. I want to thank Senator Hoeven and Senator Kramer and Congressman Armstrong, who Lieutenant Governor Brent Sanford and I have been in contact with this afternoon as well. But those three are working hard to help pass legislation to help address the deregulation to allow us to effectively manage this medical crisis. And they're also working on some really significant economic legislation to help provide support support for those businesses and individuals affected by this. And the other role that Senator Hoeven plays is that he's chairman of the Senate Indian Affairs Committee. Last night, again, as part of our regular rhythm, talking to businesses and leaders and health organizations around the state, we had another call last evening between the governor's office, Scott Davis, who leads Indian Affairs, the 5 tribal chair leaders with whom we share geography, and many of their council leaders. We were on from 5:30 to 7:30 last night, getting great input from all of them. Independently, because as sovereign nations, they're all taking a bunch of moves, but we want to thank them, the tribes and the tribal cheerleaders and their councils for taking the courageous decisions they're doing, and most of them are moving towards closures of their casinos this weekend, following other actions that they've taken prior. So we appreciate their collaboration. After the call last night, Scott Davis and I also and our staff got on the phone with Mike Andrews. He's the staff director and chief counsel for the U.S. Senate Committee on Indian Affairs. Again, advocating, as we did with Senator Hoeven. I know he's also championing this, but working to make sure that the tribes in our state and around the country are remembered in all the legislation that's happening. Next topic, we have one new executive order that we've signed today, and today, just before again this conference, signed executive order that's going to help us on another aspect of social distancing, because social distancing helps slow the spread of COVID-19. But what we're doing is we're expanding the list of those authorized to administer COVID-19 tests to include licensed pharmacists in our state. So that'd be another location that you could potentially get tested, and that's in collaboration with the North Dakota Department of Health. So a licensed pharmacist could do the swab and send it in. Gives more places for people to get tested, increase our overall testing, which again, if it improves our data and helps us make good decisions. Another thing, which is we're doing is through this executive order, is under current law, if you're a pharmacy and someone's prescription for their what would be considered an emergency medication, they're only allowed right now to refill that for 72 hours. Then they have to go back to their doctor and get another, written prescription. The emergency refills would be for things like chronic diseases that would include diabetes, so a prescription for insulin, blood pressure, cholesterol, these kinds of chronic those kinds of chronic things. We are allowing now through executive order that licensed pharmacists, and working with the Pharmacy Association and working with the insurance commissioner, John Gottfried, also worked on this executive order, but this executive order will allow pharmacists to do emergency refills for up to 30-day supply, where previously it was 72 hours. Excluded in this order are all class 2 licensed drugs, so that would include all of the opioids are excluded from that. So you're not able to get a 30-day supply for an opioid, but for emergency refills. One of the other things that also exists in regulations is that if someone is delivering these medications to a home, it's required proof of delivery. That generally means that somebody needs a signature before a mail-in or others could drop it off, and we're dropping that requirement of the proof of delivery requirement to reduce person-to-person contact when those medicines are being delivered. Okay, that's the executive order related to pharmacy and pharmacy testing and refills. Next topic. Been getting a lot of questions about driver's license and motor vehicle registration. As we announced yesterday, through yesterday's executive order, all driver's license and motor vehicle registrations that expired March 1 or later will still be recognized and honored throughout the duration of this emergency. We've added to that today that the TSA will also indicate that it will honor expired North Dakota driver's license, so people could board a plane if they had essential travel. We want to reaffirm, as we do for all activities in state government, that even though we're moving people off site, we are open for business, and the North Dakota DOT is open for businesses, and we will have restricted access starting Monday, but the DOT is open. Many driver's license services can be provided online. Appointments and other in-service purposes will not be available for Class D driver's license renewals, real IDs, tests for driver permits or licenses. So those are not available. But one of the essential things we have to keep moving in our state is commercial driving, because commercial driving is essential to our state's economy, whether that's medical supplies, whether that's agricultural commodities to help feed the nation, or other essential goods that we're trying to resupply the supply chain here for food or supplies for people in North Dakota. So we did have a backlog on CLD driver's license, so we're going through some special work to do that. But renewals, permits, knowledge tests, road tests, and new licenses will be available and can be scheduled by appointment starting March 30 as NDDOT develops a process for scheduling, because we got a backlog, I think, of over 300 CDL licenses that we're trying to move through to make sure we don't have any restrictions there, but part of the work that they're doing on the process for how to schedule this, there will be requirements where both the testers and the drivers would be required to wear N95 masks, during that driving test portion. Motor vehicle licenses such as license plates and titling can be done by mailing in paperwork. Vehicle renewals can be done online or at self-service kiosks or by mail. And happily, NDDOT is waiving the motor vehicle kiosk fees for renewing your vehicle until the emergency declaration is ended. And then maybe we can take a look at waiving it after that. I've never liked that one. Anyway, so for more information, dot.nd.gov is on those. Rest areas, we've been talking about those every day. We've got new schedule updates from DOT. Again, this involved repairing stuff from vandalism at the rest areas, and it also involves having more cleaning crews there to make sure that we're doing the right kind of sanitation and work when we're the environmental cleaning work there. But on Sunday, tomorrow on I-94, the Bismarck eastbound and westbound are going to be open. On Monday, Mapleton, Lynchburg, and New Salem, westbound and eastbound on I-94. And on Tuesday, the Elm River, which is between Fargo and Grand Forks, that rest stop, northbound and southbound on I-29 will open. Again, more information on that on dot.nd.gov. Next topic we want to talk about is hospital preparedness. We've talked a number of times at these sessions about trying to make sure that when we do have a surge in cases, like now we've got 3 hospitalizations, we can handle that. If you see places again like Italy, where New York, California, Washington, they had so many cases so quickly as things spiked up, they were unable to provide all the services that they wanted to be able to provide. So then this is and again, we can save lives if we've got access to 3 things. 1 is hospital beds, 2 is equipment, including ventilators, and 3 is ventilators and personal protective equipment for the medical personnel, and then the 3rd is staffing. So those 3 streams we continue to work on through the Unified Task Force. But we are posting online. We've talked about flattening the curve a number of times. This is a infographic which is going to go up on the North Dakota Department of Health social media and on their webpage. We would ask people to refer to this if this is something you can use to help explain to your kids, explain to whoever you're talking to. But the pink line here that's the pandemic development without protective measures. The blue line that comes across is the healthcare delivery system capacity for dealing with COVID cases. And by all the efforts we're doing on social distancing to slow the spread, will stretch it out over time. The area under these 2 curves may be exactly the same, meaning the same number of people are going to get sick over a period of time. But in the bottom scenario, with appropriate health care, then you have lower mortality. Fewer people die because we're able to care for them, and we don't put anybody in the position that they got to in Italy, which is they had to decide which patients got a ventilator and which ones didn't. And literally then you're taking people who've dedicated their lives to the healthcare profession having to make life or death decisions. That's what we're trying to avoid. None of you would want to have to make that decision for any of your loved ones, or if you had 2 loved ones, pick which one. So what we're doing here is helping to flatten that curve. So again, that's available online.